Hey guys, today we're going to be talking about something a little different than the norm. I'm going to be delving into my previous career notes and my reflections as I was a nutritionist before I became a psychotherapist. If any of you have listened to my past podcast episodes, you know that I have a master's degree in nutrition from Tufts University, which is a pretty renowned school of nutrition. And I know a lot about the human body, and I am seeing now as a psychotherapist, I'm seeing how many of my clients are actually being or experiencing harm from the medical establishment to the point where I just no longer feel like I cannot say anything because I see it, almost daily, actually. So I want to talk today about what that harm is called. The word for it is actually called iatrogenic. And iatrogenic disease or illness or harm is what we call harm that is done by the actual institution of the medicine or the doctor or, the medical establishment. It literally means in the Greek, genic means something where its origins come from. So disease generated by healer, the healer. Iatro in the Greek means healer. So a study I read, it was actually a meta-analysis published in the British Medical Journal in 2019, looked at various medical settings in the UK, and they actually found in their meta-analysis about 1 in 20 patients were harmed from the medical care itself. So the iatrogenic disease in their meta-analysis was about 1 in 20 people, or about 5%. So that is not a small number. If you are someone who is in the care of a medical doctor, often you can imagine it's going to be even higher, because that was 5% during that snapshot in time of those studies that were involved in that meta-analysis. So over time, your incidence or your prevalence of likelihood of being harmed by medical care is going to substantially increase. So let's talk about the history of iatrogenic disease, because it is not pretty. So a little known fact is that the first incidence of iatrogenic illness in Western history was by a disease that was called childbed fever. The medical name was puerperal sepsis, but it was known as childbed fever, which killed many women who were pregnant and in labor, as well as their babies, in the West, so in Europe and in the United States during the 17th, 18th, and 19th centuries. It was finally halted when 2 different doctors, one who was in Vienna and one who was here in Boston in the United States, actually started noticing that there was a correlation between the mothers and babies dying and those obstetricians that had just come up from the autopsy floor or basement in that same hospital and did not wash his hands before he then went from touching the cadaver to helping to deliver the baby. So once they made that link, unfortunately, both doctors, one was called Oliver Wendell Holmes and the other was Ignaz Semmelweis in Vienna, both were actually ridiculed by the medical establishment for a number of years until their theories started actually gaining traction, and other people started noticing, yes, actually the lack of hand washing did seem like the reason that these infants and mothers were dying. So that's an extreme example of iatrogenic disease that lasted for several centuries, unfortunately. A more recent example is what took place in the 1950s and early 60s in the US and many other countries, where pregnant women who were having nausea were routinely prescribed a drug called thalidomide. I think I'm saying it right. Thalidomide, maybe that's the better saying, for their nausea. And unfortunately, that drug, thalidomide, ended up creating severe deformity in those fetuses that over 10,000 infants in 46 countries during that decade or so were born with missing limbs altogether. So those are the iatrogenic deaths and diseases that do make headlines, that are pretty sensational because they're extreme and you can see them visibly, but most don't. And those include hospital-borne infections, such as staph, strep, and pneumococcal bacteria that are antibiotic resistant, and they actually can grow pretty strongly within the hospital itself, infecting people like my grandfather, who in his 80s was very, very healthy, went in for a minor surgery, and ended up actually dying from the hospital-borne infection itself after his surgery. Other iatrogenic illnesses include drug side effects, false positives from medical tests. And yes, I want to pause here and just say there are a lot of false positives from medical tests. I've had many clients tell me that they were told that when they were pregnant, that their fetus tested positive for Down syndrome, and they never had a child with Down syndrome. The child did not have any Down syndrome, in fact. I cannot tell you how many of my clients have been given positive results for a whole litany of tests that they actually did not have that cancer that they tested positive for, or a lot of other false positives. So I just want to reassure you, you're not going to hear this from the doctor necessarily, but false positives are actually more common than one would think. Other iatrogenic illnesses are from surgical errors, complications from unnecessary interventions, and unnecessary tests. In the United States especially, many doctors just prescribe a lot of tests unnecessarily, and that is because we have such a huge fear of malpractice and liability. And that is really inherent to the US. If you go to other countries, they don't routinely prescribe as many tests for their patients because they don't have the same level of litigation that we do here in the US, and they're not as fearful of malpractice. But a lot of those tests themselves have their own inherent side effects, and we're not told about that. And that's something we need to consider. They have their own risks. Also, ironically, we go through all these tests, but then the actual diagnosis that we finally get, the medical establishment can actually do nothing for in many cases, such as whenever that disease is a result of inflammation. So any kind of autoimmune disease or inflammatory disease, the medical establishment actually has no antidote for those things. There's nothing they can do. So they're making all this money off of us with all the tests that they're running on us, and yet there's nothing they can do about the actual disease when they learn what it is. According to one research article published in the World Journal of Pharmaceutical Research that I read, iatrogenesis is increasing primarily due to the commercialization of medicine. And I'm quoting here. Pharma companies declare their drugs as effective as they sponsor the actual development and have ties with the petrochemical industry and financial companies. These companies spend less on research and more on advertising. As a result, the actual efficacy and effectiveness of the medication are masked and side effects go unnoticed. Let's talk about medical school as well. I do not think doctors are inherently bad people, but I do think that they are indoctrinated, as the name is, doctors. So let's talk about this, because the research I did for this essay or this article that I'm sharing with you actually found that most medical schools in the US are funded in large part by pharmaceutical companies and medical device companies. In fact, the article that I read, published in the Journal of American Medical Association, they surveyed all 125 medical schools, and they found that about 2/3 of those hospitals and those medical schools of the teaching is paid for by the drug and medical device companies. So what happens when the actual education is brought to us by vested interests? Well, doctors get indoctrinated. Basically, they are taught that the only antidote for illness is drugs and surgical intervention or medical devices. For a fascinating and yet horrifying look at the medical device industry itself, please watch the documentary called Bleeding Edge. Everyone needs to see this expose of how American medical device companies are able to get away with making billions of dollars while actually disabling the people who use their devices. If you watch this, you will never be the same. And it is like watching a horror movie that is true, a slow-mo horror movie that is based on real life. So at these medical schools, because they are primarily sponsored by the vested interest of medical devices and pharmaceutical companies, there is no teaching on prevention. There is no teaching on nutrition or even how the human body will heal naturally when it's healthy over time. They certainly do not learn the dangers of intervention. When I say intervention, I mean drugs, I mean surgeries, I mean medical devices, any kind of human intervention. They're not learning that in these medical schools because they're being taught by the actual stakeholders in the industry of intervention. So it's kind of ironic. Yet the interventions themselves are dangerous. Another great documentary that kind of illustrates this is called The Business of Being Born, which is a film that shows what happens when women go to hospitals to give birth. They actually show in this film the head of the OBGYN department at, I believe it's New York Cedars-Sinai, and he looks at the camera and he says, if you have a healthy pregnancy and you do not want an unnecessary medical intervention in your birth, stay home. This is not the place for you. Do not come to our hospital. Stay home. He literally says that in this film. Also, at one point in the film, they ask a room full of medical residents to raise their hand if they've ever attended a birth without medical intervention. And not a single one of those medical residents raises their hand. And they respond that they are not trained to simply attend a natural birth without intervening medically. So there's a bias. They are indoctrinated. Also within the medical establishment, there is no concern for the root of the disease. Doctors know all about how to remove a gallbladder, but no one ever asks why that gallbladder is so infected and so filled with bile in the first place. By the way, here's a freebie. In my former life as a nutritionist, I learned that bile is excessive and formed excessively when we humans eat a low fiber diet, which is what we call the standard American diet, also known as SAD. Standard American diet. It's so low fiber that we actually produce excessive bile. But eating fiber from a high fiber, primarily plant-based diet actually helps us excrete bile and it regulates our bile production, and we are far less likely to develop gallstones or any kind of gallbladder disease. But no one talks about this. Throughout most of history, physicians treated illness either through prevention or through natural means. For example, tuberculosis hospitals that were formed in Europe and in the United States were primarily asylums for tuberculosis patients to escape cities, which were polluted by soot from the industrial era. And escape into fresh open air. And they were actually located in mountainous regions in the Alps, in Italy, and in Denver, Colorado in the US. The medical model today does not view the body as a miraculous entity that should be supported through daily nutrition, water intake, sleep, fresh air, and exercise, and left alone to heal naturally and to attune to, meaning that we should listen to our body and listen to what it feels and what it needs. On the contrary, modern medicine views the body as something static, not dynamic, something that is not inherently wise and knows what it needs, but something that needs outside help from so-called experts. So I want to share with you, and I think I've shared with this before on my podcast, but when I was pregnant, I really wanted to have a home birth. And I did go to a prenatal visit with a doctor, and she was a really cool woman, actually. And I told her that I was considering having a home birth, and she actually encouraged me to have a home birth. She told me that she had done so much of her training in Texas, which I guess is a state where there is just a better environment for having home births, and that she trained with midwives, and that she was so impressed with how much midwifery knew and the techniques that they would help to facilitate birth with those women. And she actually learned quite a bit herself in her own residency when she trained there from the midwives. And she told me, here in California, the nurses hate working with me because when I have a woman in labor and she wants to go for a walk around the room to expedite and facilitate her labor, I let her. And when she wants to take a shower to soothe her, I let her. And when she feels the need to squat in the toilet to help facilitate her labor, I let her. And I thought, well, she's telling me this. You let her? You're like the only doctor who does that so much that the nurses hate working with you? And basically I told her, you've just talked me into having a home birth. And she said, good. And I did. So that's just an example of how the modern medical establishment does not encourage us to attune to our bodies and see our bodies as inherently wise. Another example and another great media source here is actually a series called Dope Sick, which I think is on Netflix. I don't remember, but I watched it a few years ago. Dope Sick is it's a fictional account of the true story of OxyContin and the family called the Sackler family, who were the pharmaceutical, the people who created the OxyContin and promoted it and caused so many people to become addicted. So it's called Dope Sick. And in the series, there's actually a part where they have one of their sales reps is trying to break into the European market and get OxyContin approved. And he knows that the best way to do that is actually to break into Germany. And if you can break into the country of Germany for approval, then you basically can get into the rest of the European market. And so he actually tells the man from the Sackler family that he was unsuccessful. And when the man asks him why, he replies, well, the Germans are different. They actually have a different attitude about pain. You see, they believe that pain is a necessary and natural part of healing. And I just remember listening to that and seeing that and just being like, yeah, actually, wow, that is mind-blowing. So don't get me wrong. I am grateful for painkillers when needed. I am grateful to have access to potentially life-saving surgeries, but these should be exceptions, not the norm. We should not feel entitled to escape all physical pain every second of our lives, and we need to trust our bodies to heal themselves and to be patient in this process. The truth is, the medical establishment no longer represents health, as it did even when I was a kid in the 70s. I remember in the 70s that doctors knew about home remedies. They knew that you can mix some baking soda into warm water and drink it for an upset stomach and you would feel better. They knew about fresh air and they prescribed going out into fresh air. I never hear those kind of things anymore. The amount of pharmaceuticals in the market today is, I don't know, thousands of times more than we had in the 70s. Things have really become exponential. So we might have today the latest cancer technique, the latest cancer treatment, but we have no idea that our bodies naturally fight cancer by removing toxic substances when we eat a high fiber diet or drink sufficient water. And our bodies will do this for us. They will remove toxins for us wonderfully if we eat a high fiber diet and drink substantial water day and night, because our kidneys, our urinary tract, it's designed to excrete toxic waste, and we can help it if we drink enough water. Our digestive system is also designed to excrete toxins out of our bowel movements, and we need to help it by eating substantial fiber. That's what it is for. But no one tells us this. No one tells us how to prevent cancer in the first place by helping our bodies work in this way day and night, which is what our bodies really want to do. Pharmaceuticals actually contribute to disease because they interfere with our microbiome, our gut. What drugs do is they actually upset the pH balance of our gut, of our microbiome, which causes something that is termed dysbiosis. Dysbiosis basically means that we have an unhealthy microbiome, and now that we have an unhealthy microbiome, we are going to naturally produce more inflammation, which leads to chronic diseases like diabetes, ironically, heart disease, and other autoimmune and inflammatory diseases, and cancer. So we are cutting off our nose to spite our own face. The single most powerful thing we can do to improve our health is to improve our microbiome by avoiding all medicine as is possible and by eating a high fiber diet, which creates a state of healthy microbiome biosis. The truth is, aside from if I were to get into a car accident and need acute surgery, the modern medical establishment has nothing to offer me. Only I can take care of my body. Only I can promote health through my diet, a high fiber diet, plenty of water, fresh air, exercise, and sufficient sleep. No one can do this for me but me. I alone am the proprietor of my body, and I need to nurture it. When I do these things, I won't develop disease. Plain and simple. And there's no shortcut. So thanks for listening to me today. I know that's a lot. Feel free to listen to this twice. I've said this before. I listen to all my podcasts that I listen to them all twice. It really helps. But feel free to subscribe. Feel free to share this with a friend or two. And please give me a 5-star review. Thanks so much, you guys.